Why, hello there! As you may already know, I am finishing my final semester of my nursing degree. I thought it would be interesting to talk about how it's been to transition within the program and what it's like to be a trans nurse. As always, I'm gonna throw my words into the air and whatever lands is what this is. Glad we settled that. So I mentioned previously, by April, it will have taken me 7 years to get my degree. It's typically a 4-year degree to be a nurse. A lot has happened, and a lot of what drove me to take time off was transitioning. I needed time to contemplate my gender identity, process what was going on, and start my transition to the point where I feel comfortable. It just felt very vital. And a good example of this is I was going to do my 4th year in the fall of 2019. It was my first time really presenting as myself within the program. There was no pandemic, so classes were in person and we had to do a presentation in front of everybody. I wasn't really training my voice as much then. I was super self-conscious about it. I didn't feel in tune with myself. It was too much anxiety. It was way too much for me to go through. And looking back on it, if I would have continued that year, I would have failed out. Throughout the process, I was really lucky with how faculty was in terms of the reception of me being transgender. Academic advising and the lead of the program were very empathetic. They didn't come to conclusions. They understood that I needed time off. They understood that it might be hard. There was one thing though that has been hard in general. When I was struggling with my transition and struggling with just existing as a trans woman, a lot of people would say it's okay, you don't have to worry about it, just do it, just get the job done. I'm very appreciative that those people are vocalizing that it's safe for me to be myself around them, but also it overlooked what I was going through. The amount of anxiety was insurmountable. It was it's something I can't put into words. I really appreciated that the lead specifically didn't try to say anything. She was just like, you do what you need to do and I'm here for you. Amazing. So good. But entering my final year this year and actually going through with it, I knew that she was helpful and she could help me with anything, but I'm not really dealing with her. In your 4th year, you get paired with one specific nurse who's your preceptor and you follow them in whatever placement you have. I was very nervous initially about who I was going to get, what they were going to think of me. Again, I did luck out last semester. My placement was within mental health and the person I was working with was very open. I told her that I was transgender and she had no idea because thank COVID, we're wearing masks. Nobody can see any of the things I feel dysphoric about. But she was so chill about it and she was willing to learn. I did, however, struggle with doing classes over Zoom. In person is hard too, yes. But in Zoom, it zooms up on your face. So funny. And I'm just I'm worried about this. And I'm particularly worried about my voice. And sometimes my voice is raspier than others. I know people are don't care what other people think. That's a funny joke. There's a lot of pressure. I'm very in my head about my voice. That's happening this semester too. I've only had 6 shifts so far at my placement. Sometimes I'm so chill and my voice is just whatever and I'm talking, I'm having a good time. And then other times I notice it's sounding a little deeper, raspier, and then I get in my head about it and it gets worse. And then I beat myself up about it and it just becomes a spiral. There's so much anxiety associated with not only being a student nurse, but being dysphoric. The imposter syndrome that I've said I felt before carries into this placement. Staff is predominantly female and I feel do I fit? Hopefully I can get to a point where I'm open to my preceptor about it and I can talk on the floor about it. So I'm a healthcare aide on the floor beneath there and I'm open about it with them. They know. I hope I can get to that point as well, but it is hard with new people. And the reason that I like to talk about me being trans to my coworkers and other people in the workplace is because it's so important to have the visibility. There are some trans women who like to pass and blend in and not talk about their identity, and that's fine. But I like to because I think it's important to have representation. There aren't a lot of strong trans women in healthcare. In some ways, the healthcare system is not conducive to trans women, just like society is. It's definitely a representation of that. So it's nice to get your way in there and let people know that it's okay in a sense. Using that as a driving force is always helpful. We got this, trans girls, we can do this. And also, even if people are discriminatory, it's important to remember that it's within the nursing code of conduct to treat people as equal. It actually says in the legislation that despite your morals and beliefs, you treat your patient respectfully, with dignity, and try to understand where they're coming from. Even if you don't agree with somebody being trans, supporting them as a patient, and you're a nurse. You shouldn't be discriminatory. If you have any questions about nursing or whatever, anything pertaining to this video, do leave them in the comments below and I will try to respond. Beating a dead horse at this point, but I'm awful at responding. I will do my best. But overall, things are going very well with myself. I hope everything is going well with you as well. I know a lot has happened in 2021 so far. We were all hoping with our fingers crossed that it was going to be better, and it's kind of been like a little rocky. Yes, there was the Capitol Hill stuff, but Kamala Harris is in office, so maybe that'll mean good things. Remember to take care of yourself. I know there's restrictions on socializing, but have as much fun as you can. Do lame things. Make stupid jokes. Make YouTube videos where you act a fool. I will see you in the next video.